5710 or WhatsApp 287-0971. Or Rev-Up office numbers are 572-0383 and 572-0215. Rev-Up St. Lucia, the alpha of radio.
Doctor in the House brought to you the compliments of La Place Salazon, Ultramart, the Labrie, Cooperative Credit Union, and Tapia Hospital.
At Tapia Hospital, caring and competent obstetric consultants who will see you safely from prenatal care through delivery with a team of excellent pediatric and anesthetic support. Tapia Hospital, where the patient's safety comes first.
At Labrie Cooperative Credit Union, we have one simple goal: to help you grow. Because when you grow, possibilities expand. We're about growing wings, growing ideas, growing you. This is your time. A time when your plans and dreams fall into place. When what you thought to be impossible with our support is indeed achievable. And best of all, it's a time when you can look back and see your growth. So, on life's journey, set your goals high. We'll be with you every step of the way. And as you grow, so should your opportunities. Labrie Cooperative Credit Union. We're not a bank. We're better.
Looking for a one-stop shop for all your grocery and household needs? Look no further than Ultramart. We stock a variety of options from the world's leading brands, all at affordable prices. Whether you're looking for fresh produce, pantry staples, or household essentials, we've got you covered. And that's not all. Don't miss out on our ultra specials and promotions for a chance to win hundreds of dollars in vouchers, hampers, and special prizes. Visit any one of our 4 convenient locations today or check us out on our Facebook and Instagram page. Ultramart, your one-stop shop for all your grocery and household needs. Shop smart. Shop Ultramart.
It's delicious.
La Place Salazon is the true home of quality meat and deli products, selected and priced to suit every palate and pocket. We sell all cuts of meat, poultry and fish, from tasty lamb necks and succulent pork chops to lean dolphin and juicy top round steaks. Our deli items include turkey, ham, bacon, pork sausages, meat patties, chicken nuggets, deli ham and eggs, so that breakfast or that party is a breeze. And for your added convenience, we sell restaurant essentials and grocery items. So where's your next meal coming from? La Place Salazon, of course. La Place Salazon, Castries, Groselet, Beaufort, and Soufrière.
It's delicious.
It's now time for Doctor in the House, hosted by Dr. Leonard Suraj. Dr. Suraj, a very good evening to you.
Good evening, Andre. Good evening, listeners and followers of that program. We are here today talking about Doctor in the House, and I have with me Dr. Tamara Remy, not a newcomer to this program, and she will be discussing matters of diseases of the breast. Remember that men have breasts as well, but they don't run into as much problem as ladies do, so we have to have a special mention that breast diseases, we always associate breast disease with cancer. Not all diseases are cancer, and therefore Dr. Tamara Remy will be here to give us a dossier on all these diseases that can happen. Welcome, Dr. Remy.
Thank
you very much for coming here with me.
Thanks again, Dr. Suraj. I feel like I'm always here on your program, but I don't mind. I don't mind at all.
It's
usually speaking about cancer or something like that, but this time we're going to talk about the more common things that affect the breast.
So what are the more common things you see in the breast, and in what way this can be prevented?
So let's start with what exactly your breasts are, what makes up your breast, so that we have a better understanding moving forward when we use certain terms.
Okay.
All right. But I would like to start off by saying that breast cancer is not the most common disease that I see that affects the breast. And just generally, doctors who deal with a lot of breast conditions, yes, breast cancer is probably the most serious one that we always, want to make sure that we diagnose early enough. but by far it is not the most common. Okay? As you very well said, males and females have breasts. Obviously, the development of the breast occurs more in females. And I say to my patients all the time, the main reason that we have breasts is to feed a baby.
That's right.
So anything else that you use your breast for, hey, that's bonus. But the main purpose. And so if we think of the breast as an organ that is meant to produce milk, and there needs to be a way for that milk to get to the baby, then it's a little easier to understand the actual anatomy of the breast. So breasts come in different sizes, different shapes, but essentially contain the same things, okay? And the main difference between male and female breasts is the ability to produce milk. So each of our breasts will have a nipple, right? That's the pointy part of your breast, although not everybody's breast is pointy or nipple is pointy. The black part is referred to as the areola, or the darker part is referred to as the areola. So in Caucasians, it's probably pink or a different color. And a lot of the breast is made up of fatty tissue. But the delicate actual tissue that's responsible for the production of milk, we can refer to them as milk glands, but the scientific name for them would be lobules.
Okay.
And then we have pipes that will take the milk from these milk sacs or lobules and get them to the nipple where you can get milk to feed the baby. So when you squeeze the breast in a woman who is breastfeeding, you will see that the nipple is where the milk is coming out. So
and there are quite a few of those nipples, these
the ducts or the pipes, right?
Pipes, yeah.
So in your own time, everybody can just take a peep at their nipples. You should have about 20 holes in the nipple. So it's usually 21 of them that we refer to
consistent as that, huh?
Yes, it is.
Beautiful.
And each of those goes down into the breast. So it's almost like Wasco, where you have a big holding place for water, reservoir, exactly. And the pipes coming from that central place get smaller and smaller and smaller as you go into the communities and each house. So same thing. In the nipple, you have about 20 of these bigger pipes. And as you go down into the breast, it gets smaller and smaller and branch off into the milk sacs. Okay? So men do not have milk sacs. So men who are born male, because now we have a lot of different things happening, men who have become female.
Yeah.
So with men, you do not have these lobules or these milk sacs. And so I think, as I've mentioned before on different programs, there are some things that will not occur in males that will occur in females. Okay? And this tissue is very, very delicate. Now, your breast only really matures when you go through puberty, and certainly when you start to breastfeed. Most times, the actual maturity of your breast occurs, or the breast cells occurs, when you breastfeed. And on a side note, that is what is thought to be somewhat protective in the development of breast cancers. Okay, so one of the risk factors for breast cancer is a female who's never been pregnant or never breastfed, because the cells have not reached maturity. Okay, so
the breastfeeding can protect you against breast cancer?
It's thought to. It's thought to be somewhat protective.
Right.
However, having said that, a lot of women who we've diagnosed with breast cancer have had children and have had breastfed, right? Yeah. So it's not completely protected, but it is thought to be somewhat protective. There is a correlation. Okay. So that's kind of looking at the anatomy and a little bit in terms of physiology. The breast development, when we start to produce milk, and all the things that happen with the cycle, the menstrual cycle, in a fertile female, as well as what happens as you get closer to menopause. A lot of the physiology or the activity or the function of the breast is related to hormones. And so hormones play a very big role in a lot of the breast changes, the breast diseases and complaints that we see with a lot of females.
And what would that hormone be?
So we have estrogen predominantly, but we do have estrogen and progesterone. When it comes to the actual production of milk, we're talking about prolactin. Okay? And so just like the menstrual cycle, depending on which hormone is at its peak or it's rising or coming down, you have different phases. And a lot of times, those hormones affect the breast and what the breast is doing. Okay? So in terms of development, a child or puberty is somewhat defined, usually by the age of 12, 9 to 12. Some cases, I've noticed our kids are getting breasts much younger. Some of it is related to being overweight and obesity, but some of it may very well be to the hormones. So I'm not sure. A lot of it has to do with what we're eating as well. But certainly by the start of the periods in females, by around 12, 13, a lot of our young girls have breasts. You will also find that some of our young males have breasts. Again, maybe related to overweight, obesity, or the hormones. So males and females have the same sort of hormones, it's just the amount or the proportions at different phases in life. So males predominantly have testosterone, but they do have some estrogen and progesterone. Likewise, females do have some testosterone. So if we start from puberty, prepubertal periods, we can start seeing that there are some breast changes and some breast diseases that occur. And the most common is gynecomastia in a male. So that's where you have breast tissue when you are pubertal or just going through puberty. And that is most likely because of the hormones. It tends to be bilateral, meaning on both sides, but it can affect just one breast more than the other. And the general thinking is if you try to get these teenage boys to do a lot more exercising, watch what it is that they eat, a lot of times by the time they get to young adulthood, that gynecomastia will resolve.
Really?
Yes.
Actually,
But a lot of times, I think, especially genetically, and now especially with a lot of our young people being overweight, it doesn't quite disappear. And unfortunately, I have had patients who've come almost demanding that something is done because they get bullied at school because they have breasts. And we're not talking about little breasts, we're talking about sizable breasts. Again, hormonal changes.
Young boys, huh?
Young boys, 13, 14.
That must be a psychologically affecting them.
It definitely does, because imagine you're on the court trying to play basketball or any of that, you can't take off your shirt. You feel very self-conscious. You don't want to be running up and down, because like with the females, you run up and down and everything starts to shake.
Bounce,
and you know, our kids are not nice. We've become a lot less tolerant. And so I find a lot of the males, so I've had to do operations on young kids. Although, you know, you try to encourage, you know, the dietary and the other habits, exercise, because remember, as I said, a lot of our breast is made up of fat. And so sometimes that helps. But the self-image and the psychological part of it, sometimes you need to remove the excess breast tissue. And we're not too concerned about disrupting things, because males are not going to breastfeed. So you just get rid of the extra tissue, and cosmetically it looks fine. All right. On the other side, we have abnormal looking breasts sometimes that occurs with females as they go through puberty. So sometimes the breasts can look like sausages. They have a different shape altogether, and that has to do with the whole development of the breast and all the connective tissue in the breast and how that actually develops. Those are sometimes less likely to resolve when they go through puberty, and sometimes surgery and reconstruction is actually the way to go. So we've had a couple of young girls, 13, 14, and their breasts look like almost like sweet potatoes. So they're tuberous. They look like a potato or a sweet potato instead of the normal
rounded
form of the breast and shape of the breast. And those patients I would probably refer to a plastic surgeon early on, so that the conversation can start, because it's less likely to actually change as they get older. Okay.
But are these breasts able to produce milk and everything?
Not normal. Not in a normal way.
All right.
Yeah, because of the way that the tissue in the breast is developing. Yeah. So we start off from there, just the developmental part. And then you have things that you have absolutely no control over. So, for example, another common presentation in my office would be women who are complaining that they have a lot of extra fat underneath the arm. And when it's time for the periods, that portion of under the arm responds almost the same way as the rest of the breast. So it gets very tender, it gets swollen. When they're pregnant, it gets swollen and uncomfortable. A lot of times there's no nipple associated with that, but we call that accessory breast tissue. So it's extra breast tissue that's in an abnormal place. But remember that the breast actually goes up to under the arm. It hangs from that portion. And so you can get a lot of breast tissue underneath the arm. And the main reason for doing anything about that, which is usually to remove the extra tissue along with some extra skin, one, the discomfort that sometimes happens, but more so cosmetics. So they don't like how it looks because they don't want to wear strapless or, you know, clothes that are going to expose under the arm, and everybody's like, what's happening underneath your arm? So usually we have to surgically remove those. As my practice is, I send everything for pathology for testing so that we just make sure we're not missing anything.
But it's generally, sir, it's a rule in training that any part of the body you remove, you send it for testing.
Yes.
Even if you know in your mind that nothing is going to be serious, but we still do it as a matter of habit.
For completion. Because you just never know. For me, for medicine, there's no such thing as always and there's no such thing as never. I never, I just said it, but I tend not to ever use those two words when it comes to talking to patients about that.
Because you've seen so many variants of normal.
Exactly.
That, you know, after a while you get wise.
Yes, you do. So those are like beginning in the early stages that can continue through life in terms of abnormalities of the breast. I forgot to mention that with the gynecomastia that we mentioned, that's the breast tissue. You can get it most commonly or more commonly in young males, but as men get older, you can also get gynecomastia. And a lot of times is associated with sometimes the medications that are given for treatment of prostate cancer, which again is hormonal, and it reduces the amount of testosterone and has again a hormonal kind of influence on the breast. And so sometimes patients who are getting hormonal treatment for their prostate cancer will complain that they're noticing that they're getting breasts.
But you've had occasion to remove the excessive breast tissue in somebody receiving hormonal therapy?
No. Because that therapy is going to continue for a while.
Yeah, that's right.
And it's an accepted side effect. And I don't think at 60, 70, I mean, I'm not downplaying it, but I think you're a lot more confident as a male and can understand that that's part of, you know, what's happening with your treatment. So yes, so that's another thing that we see less commonly, but it's a known side effect, but we tend not to do anything about that. So the most common thing that I will probably see in my office is breast pain.
Okay.
And every time I speak about breast cancer, I think I allude to that I wish that breast cancers would, as their first sign, be breast pain. Because as soon as somebody feels pain in their breast, they come running to the office.
Yeah, but
Doc, I want to make sure it's not cancer. Right.
But generally speaking, pain is a protective type of symptom, you know, to tell you something is wrong.
True.
Because if you didn't have pain, much would happen without you knowing.
Without you knowing. But with breast cancer, you tend not to get pain.
Right.
And that's the problem, right? Again, I'm not going to say always and I'm not going to say never. But in studies that have been done, maybe only 4-5% of patients who have breast cancer have breast pain. So
but generally, I would say that the painless lumps tend to be more serious than the
definitely in general, not just for the breast, in most things.
Generally,
so you have lymph nodes that are enlarging. Even with childhood cancers, you have something that's just there that was not there before, and you just happen to find it. Right? So but breast pain for sure is the most common reason why patients come to my office. And the more common reasons for breast or causes for breast pain, in my experience, would be a breast cyst, and we can talk about each of those.
Okay.
What we call cyclical mastalgia, big words. So cyclical meaning cycle, mastalgia meaning pain in the breast. So again, you know that that's related to the hormones and the cycle, the menstrual cycle, and what's happening. As we said, the hormones affecting the breast tissue. Those are the two most common. For some people, if they have a small lump, which is not cancerous, called a fibroadenoma, not a fibroid. I have patients coming and say, "I have a fibroid in my breast." I'm like, no, the first few letters are the same, but the rest are not. And it's starting to get a little bit larger. You may get a little bit of discomfort. For patients who are breastfeeding, they may have what we call mastitis or inflammation or infection happening in the breast because the baby's latching onto your nipple. Your nipples are cracked. The baby's mouth with the saliva is just causing pure chaos on your nipple. And the germs which are normally on your skin, which would not normally cause a problem, now have a way to get in through the cracks, and you get a whole infection or inflammation of the breast. And sometimes it could just be the engorgement and the milk not being able to.
So what causes the engorgement? Something I wanted to ask at some point. Because I've had patients with that. And
with breast engorgement. So remember we spoke about the milk sacs where the milk is produced. Sometimes if you're not expressing the breast as often as you should, or if the baby is not latching on and emptying the breast at breastfeeding, then milk, like a lot of our fluids, is thick. And so it can actually kind of harden and cause a blockage to those pipes or actually in the milk sacs. And so you get this backup of full milk sacs that have no way of coming out. So there are lots and loads of local remedies and stuff. I mean, starting from the simplest, which would be applying a warm compress in terms of preventing it in the first place. If the baby is not latching or has a preference for one breast, whether it's because the nipple is easier to suck on one side as compared to the other. Some people will say, oh, the baby doesn't like that breast, so they don't even bother. But, you still need to express and get rid of the milk that's there. Even if you store it or get rid of it, then you have people who are in hospital after they've had the baby. Maybe they had a complication and so they can't breastfeed, or they're on antibiotics that cannot be given to the baby, or some other medication. So, or they're unable to. They may be in an ICU setting or something like that, where they're unable to actually actively express the breast, and so everything just gets engorged.
That's if there is a pump or something.
Exactly. So now everybody's with the pumps. So even if the baby's not latching on and sucking, you have ways of getting the milk out. Okay. And then the other less common would be something like a breast abscess, which is an actual collection of pus in the breast. So the same way you can get an abscess anywhere. Some people will see a pimple on the breast, especially with children, babies. They will see a little boil or something on the breast and go trying to squeeze it. And then they will have a setup for breast abscess. So you have a cavity that has pus in it, and the main treatment for that is to make a small cut and let the pus out. Right? If you have a lot of pain, if you have a lot of redness, fever, etc., you probably also need to have some antibiotics with that. But if there's pus, the main treatment for pus is for it to actually come out. Right? So no amount of antibiotics is going to treat that pus until you get it out.
Well, I've had some real serious cases with in fact mine started as a parotid abscess that tracked down. Person is diabetic, hold the patient under the skin, get into the breast. You have to open up the breast because being diabetic, you have to lay open all the tissue. And it was a very long journey. But eventually
recovery, yes. Because your parotid is all the way up by your neck, right? And you're talking about going from all the way there, coming all the way down. Yes, tracking down.
That's right.
Yes.
So, but the breast diseases that are infective usually will cause a pain or discomfort.
For sure, yes.
And those that are more sinister may not. Right.
Exactly. But the most common that I see would be between a breast cyst in terms of pain and what we call the fibrocystic breast changes. Okay, so I mean big words. So a cyst is the same as a cyst that you get anywhere else in your body, whether it's on the kidney or an ovarian cyst. It's a
collection
sac,
of fluid,
right, that has some fluid in it.
That's right.
And typically, we divide or describe them as simple cysts or complex cysts.
Okay.
So a simple cyst on an ultrasound is going to look like a little black hole. It means it's just a sac that has no debris, no anything, sediments or anything inside of it. It doesn't have partitions. It's just a little sac that has, or a big sac that has fluid in it. The more complex ones will have all of those other things, the sediments. So in the black hole, you will see white speckles. You will see lines that suggest it has
That's on
different
ultrasound.
sections on ultrasound.
Right.
Yes. And they're treated very differently.
Okay.
So cysts tend to cause pain, or they may just present as a painless lump. Depending on the size, depending on if they are causing symptoms, you can either leave them alone, or you can put a needle in through the skin and draw out the fluid. Most times the fluid looks almost like pee, so it's like a yellow straw-colored
What we call
kind of,
straw-colored.
right, exactly, which is not thick. It doesn't look like pus or anything. Sometimes maybe a little bit greenish. And we don't get most times we don't get too concerned about those colors. And usually for a simple cyst, if you've drained it, it should disappear, right? The thing is, it may come back because it's a sac.
That's right.
Right? And so, yes, the initial management may be to drain it, but then usually there's a watch and wait to see what happens after. So if it keeps coming back, and when we call it recurrent, it comes back maybe 2 more times, then there may be a need to actually remove it surgically. I have some patients who are like, Doc, leave my cysts alone, please, because they make my boobies look bigger. Thank you, and fuller. And they're simple cysts, so they're not causing any pain, they're not causing any problems. We just monitor them. Certainly, if you put a needle and you get bloody fluid, that's, for me, something to be concerned about.
Okay.
And so we usually send that to the lab. The problem, though, is that sometimes when you send that fluid to the lab, you don't pick up extra cells that may tell you what's the cause. But it may suggest to you that you need to remove the cyst as compared to just waiting for it to fill back up. Okay? Another reason why we would do something else after removing the fluid with a cyst would be if, when you've drained the fluid, there is still a residual lump or a mass there. So sometimes it may just be all the sac that's kind of crumpled up, and so it's feeling like a lump. Or sometimes it may be that there's, yes, the cyst part, but there's another component to it. And in those cases, you probably should remove what's left behind.
So if it's just a simple cyst, you expect when you put the needle and pull out the fluid in there, when you feel for it, you hardly feel anything.
You hardly feel it's
when
usually
you
completely
do feel
resolved.
something,
Right.
there will be the need to take more action.
Exactly. So you can either biopsy what's left behind, or you can remove, well, same sort of, a different type of biopsy.
Okay.
Sorry, we'll have to take a little break.
Sure.
This
All right.
is Doctor in the House with Dr. Leonard Suraj, brought to you the compliments of La Place Salaison, Ultramat de Labrie Cooperative Credit Union, and Tapia Hospital.
Tapia Hospital Radiology Department offers 24-hour service. We provide you with X-ray, CT scans, and ultrasound imaging using the most modern equipment that produces the best images for your medical attention. Call the Radiology Unit at 459-2201. Tapia Hospital, where the patient's safety comes first.
At Labrie Cooperative Credit Union, we have one simple goal: to help you grow. Because when you grow, possibilities expand. We're about growing wings, growing ideas, growing you. This is your time. A time when your plans and dreams fall into place. When what you thought to be impossible, with our support, is indeed achievable. And best of all, it's a time when you can look back and see your growth. So, on life's journey, set your goals high. We'll be with you every step of the way. And as you grow, so should your opportunities. Labrie Cooperative Credit Union. We're not a bank. We're better.
Look looking for a one-stop shop for all your grocery and household needs? Look no further than Ultramart. We stock a variety of options from the world's leading brands, all at affordable prices. Whether you're looking for fresh produce, pantry staples, or household essentials, we've got you covered. And that's not all. Don't miss out on our ultra specials and promotions for a chance to win hundreds of dollars in vouchers, hampers, and special prizes. Visit any one of our 4 convenient locations today or check us out on our Facebook and Instagram page. Ultramart, your one-stop shop for all your grocery and household needs. Shop smart. Shop Ultramart.
It's delicious.
La Plaza Salazar is the true home of quality meat and deli products, selected and priced to suit every palate and pocket. We sell all cuts of meat, poultry and fish, from tasty lamb necks and succulent pork chops to lean dolphin and juicy top round steaks. Our deli items include turkey, ham, bacon, pork sausages, meat patties, chicken nuggets, deli ham and eggs, so that breakfast or that party is a breeze. And for your added convenience, we sell restaurant essentials and grocery items. So where's your next meal coming from? La Plaza Salazar, of course. La Plaza Salazar, Castries, Groselet, Beaufort, and Soufriere.
It's delicious.
This is Live, Doctor in the House on Rev-Up St. Lucia, hosted by Dr. Leonard Suraj. Dr. Suraj, welcome back.
Thank you again, Andre, and welcome listeners for staying around and listening to us. I have with me in studio Dr. Tamara Remy, who is a general surgeon, as well having a special interest in breast diseases. And we were just continuing your journey. We were discussing issues of different types of breast complaints, etc. But before we go any further, would you like to tell the general public the numbers,
Sure.
if they have a question, or if they want to make a contribution, or if they want to suggest a topic that we can use next time around?
Okay, you actually have a call already, but I'll give the numbers just the same. The fixed line is 572-9710, 572-9710. That's the fixed line. Or you can WhatsApp 287-0971. WhatsApp is 287-0971. Again, the fixed line is 572-9710 or WhatsApp 287-0971. So we do have a call, Dr. Siraj.
Hello.
Hello, good evening, Doc.
Good evening,
Good
sir.
evening, Andre. Good evening, Dr. Remy.
Good evening to you, sir.
Good evening, sir.
Thanks for calling.
Thanks.
Okay, thanks for accepting my call.
Okay.
You're welcome.
Tell me.
Dr. Remy,
Yeah. Go
yeah,
ahead.
Good evening.
my question, yeah.
Your question
Dr.
is
Remy,
Dr.
how-
Remy. Go ahead.
How important is the bra? Is a bra to the breast?
Okay. I think the bras were initially meant for support. Certainly women, like I mentioned before, have different shapes and different sizes of breasts, and so some women probably don't have to wear a bra. But certainly those who have bigger breasts, the support for the breast is very important. As I mentioned, the breast is made up of fatty tissue. It's made up of other connective tissue that holds the breast, together, the different sections of the breast. And so even from a comfort point of view, a lot of people who have medium to larger size breasts will admit that, when they have a bra on with that size breast, it feels a lot more comfortable as compared to the weight of the breast throughout the day. We've moved from just the support to how it looks, to giving you bigger boobs and giving you more cleavage and making you look like you have more boobs with the padded bras. I think all of those are additional things, but I do believe that the initial is probably from a support point of view.
So the bra, it has nothing to do with the shape of your breast as you grow older?
I think the shape of your breasts is probably more determined by genetics, by your weight. There is some amount of what we call training of the breast when you do exercises and when you wear the bras. It keeps them in a certain, not shape, but more toned, for want of a better word. But I think irrespective of those, a bra is not going to prevent your breast from growing. or make them get smaller because you're wearing a bra. But I think the determinants of those things are by something else and not just by a bra.
Okay. My next question, I say more concern. You said the breast, a female breast, is mostly to feed the baby. Okay?
Yes.
It produces milk to feed the baby. Is it good practice for women to allow men to suck the breast?
Somehow I was expecting something.
I don't know if I can say it's a good practice. I don't know that it affects the breast too much. I mean, especially if you're not breastfeeding. Certainly, if you have a male competing with a baby for breast milk, you may put a lot more stress on the breast because you have to, every time you suck on the breast, you stimulate it to make more milk. But in the absence of you actually breastfeeding, I think it's more for pleasure than for anything else. I mean, some persons will say that they've read or heard that sucking on the breast prevents breast cancer. I don't know that I have seen scientific evidence of that. As I mentioned before, it more has to do with the fact that you have produced breast milk and breastfeeding that seems to be more protective. But just sucking on breasts that have no milk just to stimulate, I don't know that adds any benefit.
Because the reason...
Go ahead.
Hello?
Yes, go ahead.
Yeah, because you know what I mean when I say that. Is it good practice to allow? You know where I'm coming with that.
I'm not going to assume that I do. Okay.
But some women, they love it. But I just want you to tell them, is it a good practice? Because you know some women, like, they have the other half and they just enjoy when he does that. So I just want to know if it is good or not. So.
Right.
Well, I don't think I would discourage anybody from doing it. I don't know that it has any additional benefits, but I don't know that it has any harmful effects.
Oh, okay.
So like I said, anything else you use the breast for is bonus. So for some people, if that's the bonus, then that's fine.
Okay.
Yeah?
Okay.
Okay.
But one thing,
but these were good questions actually. It's a good question.
Yeah.
Let me just add, sorry, Dr. Suraj, let me just add a little more to that. Is it a myth that the bra helps to keep a female's breast perky?
I think there's some training, yes, with the breast. But if, for example, a lot of women complain that having had a baby and or having had children and breastfed, that their breasts are just sagging.
Right.
I don't know that at that point wearing a bra is going to change things so much, because there's so many other changes that have happened because of breastfeeding. So the breast probably got enlarged. Then, they sag because of loss of tissue, lots of different things. The skin got stretched, etc. So a bra by itself is not necessarily going to change those things. But in general, just like doing your pectoralis exercises, because your breast is on top of muscle, it is going to add to the tone. And like I mentioned, you do have ligaments and connective tissue that kind of keep the breast upright and perky. Those for me are probably more contributory than just the bra. But in the development, yes, the bra is going to somewhat give it a posture and a shape, I think. But for other reasons where you may lose those things, I don't know that the bra is going to be able on its own to restore.
Okay. The ladies who come to your office, do they complain about the sagging breast? Because this seems to be another issue that a lot of females have. They feel, especially maybe for their age, they're fairly young. Sometimes they look at, for example, their mother, and the mother seems to have pokey breasts while their breasts are already sagging.
Right.
So do they bring up those issues?
They do. Some do. And patients will say, Doc, you don't do reconstruction because I'd love for you to just do something about the breast. So it is a concern, and I don't downplay it because, self-image and self-confidence are big things. And if how your body looks as you get older, or having gone through pregnancy or anything, any changes, you're not satisfied, I think we should always at least have the options. So we do have a plastic surgeon who visits intermittently, maybe every 2 to 3 months. He comes to St. Lucia. So I would refer those patients. Obviously, if you plan on having more kids, you need to wait until you're finished, because there's no point in doing anything with your breast.
So any idea as to what causes the sagging, the breast to sag?
And like I said, it's different things. All of us, our bodies are going to sag at some point. The connective tissue, the collagen.
Even at a young age?
Sometimes if you have rapid weight loss, you can have sagging of the breast, because your breast is made up of a lot of fat, and which is why young people have dense, fuller breasts, and as you get older, things start to change. So for a variety of reasons, we have women who've had kids. They're younger, but they had kids at a younger age and did a lot of breastfeeding, or just how the breast and the body has changed just because of pregnancy and breastfeeding.
So you're saying that pregnancy is or may be a contributing factor to that problem?
Yes, it sometimes is. So some of us get nice perky boobies during pregnancy, and then they go back to the normal size afterwards.
Right.
And some people, the breasts never go back down, and they're complaining that their breast never went back down, and they have these huge breasts. And then other people will be like, these children, this is what they did to me. They've pulled everything in the wrong direction, going south. So yeah, definitely pregnancy and breastfeeding can contribute.
All right. So just to be sure, because you heard all the time that the bra helps to keep the breast all pokey, nice and pokey, right?
So it can in breasts that are already or still perky. If you've lost a lot of your tissue, if you've lost or have a lot of sagging skin, the breast is not going to give you perky breasts.
Okay.
What it does is give you support. So you'll have women who have nice bras and look like they have nice breasts because they found the bras that support the breast and give the look. But when they take off the bra, the breasts are what they are.
Yes.
Yeah. So a lot of people invest in good bras.
Yeah.
Yeah.
Okay, let me just give the numbers again. The fixed line is 572-9710, 572-9710, or you can WhatsApp 287-0971. WhatsApp is 287-0971. So this is Doctor in the House with Dr. Leonard Suraj.
Yes, sir, thank you.
Yes.
And also I had one contribution to make there. And I wanted to ask Dr. Remy that I know some women prefer not to breastfeed the child, thinking that the breast will remain pokey for a longer time.
Right.
And especially those in show business and those that appearance matters a lot.
Yes.
Is there any justification or any truth in that?
Just 1 second. We have a call, Dr. Suraj. We have a call.
Hello?
So we'll get back to your question.
Okay. Hello. Good evening.
Good night.
Yes, good night.
Good night.
Dr. Suraj, good night. And Dr. Remy, good night.
Good night.
Good night.
I don't have a question. Andre asking all the questions, so I didn't have a question.
So he asked your question for you.
You're asking all the questions.
Okay.
But I want to thank the Dr. Suraj for taking time off. So that's my favorite time of the evening, listening to Rev-Up, sitting and relaxing, listening to Rev-Up. I would like to thank you and Dr. Remy for taking time off from your busy schedule to be here with us tonight. I do appreciate the effort. Thank you very much. Andre, thank you very much for asking all the questions.
Yes, I try. Thank
If
you.
there's any topic
Thank you.
you'd like us to discuss some other time, you can always tell us. So I'll probably
No problem, Doc. Yes,
mobilize
thank you
the
very
people.
much.
And thanks a lot for listening. That means a lot to us.
Yes,
Right.
you're most welcome. Bye-bye.
Have a safe night.
All right. Thank you.
Yeah, thanks.
Yes.
So there is some
my question.
There is some truth to avoidance of breastfeeding, the same way that there is some truth to avoidance of having a normal vaginal delivery. Some people will tell you, I just want a cesarean section. Just cut the baby out. I don't want to go through labor and change up things anywhere. Likewise, they will say, breastfeeding is going to give me stretch marks and it's just going to make my breast look different. I don't know that there's a justification, meaning from a medical point of view. There's so many benefits to breastfeeding, starting with just the immunologic advantage, what breast milk has in it,
Right.
the bond that you form with your baby when you're feeding the baby. I mean, there are just so many benefits to breastfeeding, and most people actually, the advocates and the science has shown that the first 6 months, breast milk is all that a baby actually needs, once you're producing enough. So that really is not from a medical point of view or has any real advantage other than maybe cosmetics. I mean, there are some cases where mothers should not feed their babies. So, for example, if they have diseases that can be transmitted through the breast milk, certainly patients who are going through breast cancer treatments, those kinds of things. So you do have medical reasons why breastfeeding is not advised. But from a cosmetic point of view or just trying to prevent your boobies from sagging, that's just a personal decision that people make. But
You have another call.
Hello. Good
Hello,
evening.
good evening.
Hi, good evening.
Good evening.
Good evening to the doctors in the house.
Thank you.
Good night.
Very good program as usual. Andre asked one of my questions already.
Oh, dear.
But I have a second question.
Go ahead.
Can persons who have had plastic surgery or breast implants, can they produce milk to feed their babies? Thank you very much.
Good question.
That's a good question. Very good question.
So usually with the implants, there's a replacement of your normal breast tissue with the implant.
So they remove the breast tissue.
So remove the breast tissue in order to give you. And so there's a disruption in, as we spoke about, the sacs connecting to the pipes, connecting to the nipple, usually for breast implants. For patients who've had breast reductions, you still have a lot of things that might still be intact. But one of the criteria I suspect for reductions is that you've completed all of your pregnancies. And so, because again, you're going to get pregnant, you're going to produce milk, perhaps, maybe not in the same way or in an organized way, because when you have reductions, you remove some of the breast tissue. And so you have disruptions in the flow of milk. So one of the things they would want to make sure is that you don't plan on having children after you've gone through a whole plastic surgery process of breast reductions. Patients who've had implants, usually to get a bigger size, I don't think that we just put silicone or saline into your normal breast just to give it size. Like, we create the size that you actually want. The other reason that you may have breast reconstruction is if you've had what we call a mastectomy, removal of the breast for breast cancer, and then we put implants in. So in those cases, you would have already removed most of, if not all of the breast tissue. So to answer your question, persons who've had implants are not candidates really for breastfeeding. I don't think that the anatomy that you leave behind allows for it anyway. But I think that one of the criteria for getting breast implants would be that you don't plan on breastfeeding.
Okay. You have another call?
Very good. Hello, good evening.
Good evening, doctors. Good evening, Andre.
Good evening.
Good evening.
Yeah, I have a question.
Let's hear you.
So if you breastfeed a child mostly on one breast, would the breast that you're feeding get smaller than the other one?
I think it can go both ways. So the more you stimulate a breast, so the more you suck on the breast, is the more milk you produce. So in some ways, you're encouraging that breast to keep, a lot of us get breasts when we have a baby. So it may stay that same size. And so on one case, you may have the breast remaining bigger than the other side. And then on the other side, I've had patients who will say, this one is smaller because that's the only side that the baby sucked on. So I think it actually goes both ways. Our breasts are usually not the exact same size, even before you get pregnant. And so after you've breastfed and after you've gone through a pregnancy, it doesn't suddenly become the same size as the other one. But I think in my experience, I've seen it go both ways, where the one that the child has been sucking on has gotten smaller or it has gotten larger. I don't know what determines which way it goes.
You have another call?
Okay, thank you very much.
Hello?
Hello, good evening.
Good evening, Doc. Good evening.
You're right. Good evening.
Hello, good night.
Let's hear you.
Thanks for accepting my call.
No problem at all.
Dr. Remy, I have a friend, and every time she sees a cycle, a period, her breast get big and it hurts her. What causes that?
Okay, so that's one of the things we were going to discuss.
Yeah.
Most times, so we describe
you.
that as, thanks for that question,
Yeah, very good question.
as a cyclical, as we said before, going with the cycle, mastalgia. So the mastalgia is the discomfort or the pain in the breast. Our breasts are very sensitive to our hormones. Okay, so our hormones are produced by our ovaries, which are close to the womb, and our hormones go through different levels throughout our cycle. And these hormones have a way of affecting our breast tissue. So our breast tissue is very sensitive to the hormones. So usually in women between the age of 20 and 40, their fertile period, a lot of women will come in and say, boy, doc, I can tell when my period is going to come because my breasts feel like I'm going to breastfeed. They're swollen, they're tender, my nipple is very sensitive. And as soon as the period comes, everything disappears. So the effect of the hormones causes swelling of those same milk sacs, even though they don't have milk in them. It causes a lot of extra fluid in the breast to make the breast get swollen and sensitive. And all of it is hormonal. And so it's not uncommon. In fact, it is very, very common. It is one of the more common reasons why women come to my office, because just before a period they're like, doc, what is going on? My breast feel ridiculous. And it's one of the standard questions that I ask anybody who comes to my office complaining of anything related to the breast or just coming for a general checkup. Do you notice that your breast change? Can you tell when your period is going to come? So it's very common, but it's all related to the hormones. And as we get older, especially as we get closer to menopause, what you will find is because the hormone levels are not as consistent as they used to be when we were younger, we get the swelling and the pain and there's no period coming, but the hormones are still having that effect on the breast. So once we tell patients, we examine them and we explain to them that this is a relatively normal thing, I think a lot of the anxiety and the worrying that it might be something cancerous going on disappears. We advise them, wear a supportive bra, especially when the breasts feel heavier, not something too tight, but something that gives them that added support. So a sports bra or a nice bra that doesn't have underwire that might be uncomfortable. Sometimes things like oil of evening primrose helps with the hormones and how they affect the breast tissue. But a lot of times, just understanding that it's a fairly normal occurrence, patients are able to deal with the discomfort a lot more. If it gets really, really bad, there are other things we can do, which again are hormonal, to help to settle the breast as they go through the cycle.
So, Dr. Remy, you said it a while ago, breast is best.
Yes.
And I think we've heard that from time immemorial. Now, what happens in a situation where the baby, for whatever reason, rejects the breast? Are there any negative repercussions in a situation like that where the child himself or herself decides, I don't want the breast?
So we first need to determine and make sure that that is actually the case, right? Because sometimes it's just a frustration of the baby trying to latch on and not being able to latch on properly. So some people's nipples are not easy for babies to latch on, so teaching them how to do that properly. And there are a lot of things that we need to teach women when they're breastfeeding. So yes, there are probably disadvantages to not having breast milk because, it really does have everything that a baby needs in terms of their immune system and protection, all of everything from the nutrients, everything that they need as compared to formula, right? But there are enough cases where it is genuinely that the baby does not want the breast milk. And then you have no choice but to use the formula.
Yes.
So there are things that happen with the baby, which probably may not happen with a breastfed baby. So formulas are known to be more associated with constipation in a newborn. It draws a lot more water out of the intestines, and so they get backed up. Breastfed babies tend to be pooping non-stop. As soon as you start feeding them, they poop. In terms of their immune function, I don't really have the data, but I know that certainly that's one of the reasons why we advocate for breastfeeding. Babies tend to maybe put on a little bit more weight because you have to give them things like the formula has other things in it. But I would imagine that immunologically and certainly the bonding and all those other things are lost when you don't have breastfed babies. But certainly constipation, regularity of passing stool. The babies may not pass stool for a day or two. Sometimes then mommy gets very worried because you have to supplement it with giving them water a lot of times when they're on formula.
So would you recommend mothers check a doctor if and when that situation does occur?
Yes, for sure.
If the child is refusing to take the breast, instead of assuming that the child doesn't want the breast, there may be some other
there might
issues.
Be something else going on.
Okay, all right. Let's take a final call, Dr. Suraj.
Okay. Hello. Good evening.
Hello, good evening. I'm sorry for calling again.
That's
okay.
fine.
Let's hear what you have to say. Nice to hear you.
Does breastfeeding cause your cycle to change? Because when I gave birth to my son, I breastfed him for about 2 years, almost 2 years, and my cycle stopped for about 1 year. Is that normal or not?
Oh, you're lucky a whole year.
That's also a very good question. Yeah.
So normally the period returns. Some people will say as long as you're breastfeeding, sometimes you may not have a period, but certainly 3 to 6 months of breastfeeding. After that, your period usually comes back. So you got a whole year. Okay, that's good. That's good. No period for a year. But when it came back after 1 year, was it normal?
She hung up.
She hung up. Okay. Yeah. But usually the period goes back to what it was before you delivered. And if it doesn't, you need to make sure you're not pregnant again. That's number one, because even though you don't have a period, you can still get pregnant like closer to when it's going to come back, because you may not have any signs that 6 months is the cutoff period. It may be 4 months. So you still need to have some sort of protection, although breastfeeding sometimes is thought to be a contraceptive for a period of time, 3 months, maybe 6 months. But you just never know when the period is going to come back, because there's no absolute rule that says everybody's period stays away for 6 months. So you still have to be fairly careful. But most times the period goes back to normal. In fact, people who have polycystic ovaries or endometriosis or other gynecological problems, sometimes really, really painful periods, after they've had their first child, their periods are actually better.
Okay.
And more regular. Yeah.
Yeah. So, that was a very good question from that last lady.
Yes.
I know we are running close to the edge of our time, but there's one area I wanted to at least get a little discussion on, and that is breast discharge.
Yes.
Just to give the general public a feel of...
Okay, so that's a big thing, especially when you hear if you have a nipple discharge, you should go see a doctor because it might be breast cancer. So yes, we do say that if you have an abnormal breast discharge, nipple discharge, that you should seek professional help. As I mentioned before, if you've breastfed, if you are breastfeeding, or for some other reason, you may have milk coming from the breast. Okay, so milk, if you have never breastfed and you have milk coming from your nipple, you need to see a doctor, because it may be that the hormone prolactin is higher than it's supposed to be, and one of the serious reasons or causes of that might be a tumor in the brain. Okay, the more common ones that we see are clear nipple discharges, which if you have cysts or if you have the hormonal changes that we just spoke about happening in the breast, it's fairly common in terms of being associated with the nipple discharge. Now, when you squeeze the nipple, you need to see if it's coming just from one of the pipes or if it's coming from a few of the pipes. Sometimes that gives you an idea as to what's happening in the breast. If your nipple discharge is brown or red, I certainly tend to have a red flag up. It does not mean that you have breast cancer. In fact, it is less associated with breast cancer than it is associated with the real cause most times, which is a papilloma. So a papilloma is a little growth that happens inside of one of the pipes, the ducts, and every time you squeeze it, or if it gets, because it's very what we call friable, when you squeeze your nipple, like if you're doing your breast exam, you will notice that there's a red discharge or a brown discharge. But I don't want people to decide for themselves which one it is. If you notice a discharge that is new that you never had before, you should come to the doctor so at least we can examine you properly and make sure there's nothing there. It may be something as simple as a cyst or your fibrocystic hormonal changes. Certainly if it's brown, red, sometimes green, we would want to do other things to try to figure out what it is. But yes, it may be cancer. That is one of the known symptoms of cancer. But more commonly, a bloody nipple discharge is because of what we call a papilloma, which is not cancerous, but it is a growth that happens in the pipe.
Yeah, thank you very much. Well explained. And I think we are coming to the end of our program for today. I wish to thank you, Dr. Maremi, for accepting the to join the program, and I'm happy that we did it. When I listen to you, it is very pleasing to listen to you because you explain things so clearly and so articulate about it. That's very nice.
Thank you.
And the listeners, I would say that if you have any question to ask or any topic you all want us to discuss, we'll be quite happy to do it in due time. So, without saying much more, thank you very much, Andre.
Yes, thank you, Dr. Suraj.
For making that platform available to us.
And thank you as always for your service, Dr. Suraj.
Thank you.
And you as well, Dr. Remy.
Thank you. My pleasure.
Okay. You've been viewing and listening to Doctor in the House, heard and seen on Rev-Up St. Lucia every Tuesday from 6 p.m. to 7 p.m. So join Dr. Suraj next week, Tuesday, same time, 6 p.m. for another Doctor in the House. Brought to you with the compliments of La Place Saint-Lézard, Ultramart, the Library Cooperative Credit Union, and Tapio Hospital.
At Tapio Hospital, we operate a 24-hour emergency service for all your urgent healthcare needs. Our qualified medical specialist will be on hand to ensure that you receive the best of care. Call us at 459-2617. Tapio Hospital, where the patient's safety comes first.
At Library Cooperative Credit Union, we have one simple goal: to help you grow. Because when you grow, possibilities expand. We're about growing wings, growing ideas, growing you. This is your time. A time when your plans and dreams fall into place. When what you thought to be impossible with our support is indeed achievable. And best of all, it's a time when you can look back and see your growth. So, on life's journey, set your goals high. We'll be with you every step of the way. And as you grow, so should your opportunities. Library Cooperative Credit Union. We're not a bank. We're better.
Looking for a one-stop shop for all your grocery and household needs? Look no further than Ultramart. We stock a variety of options from the world's leading brands, all at affordable prices. Whether you're looking for fresh produce, pantry staples, or household essentials, we've got you covered. And that's not all. Don't miss out on our ultra specials and promotions for a chance to win hundreds of dollars in vouchers, hampers, and special prizes. Visit any one of our 4 convenient locations today or check us out on our Facebook and Instagram page. Ultramart, your one-stop shop for all your grocery and household needs. Shop smart. Shop Ultramart.
It's delicious.
La Place Saint-Lézard is the true home of quality meat and deli products, selected and priced to suit every palate and pocket. We sell all cuts of meat, poultry and fish, from tasty lamb necks and succulent pork chops to lean dolphin and juicy top round steaks. Our deli items include turkey, ham, bacon, pork sausages, meat patties, chicken nuggets, deli ham and eggs, so that breakfast or that party is a breeze. And for your added convenience, we sell restaurant essentials and grocery items. So where's your next meal coming from? La Place Saint-Lézard, of course. La Place Saint-Lézard, Castries, Groselet, Beaufort, and Soufrière.
It's delicious.
Rev-Up St. Lucia is located at Unit 4, Gablewoods Mall, Sunny Acres, Castries, St. Lucia. Tune in to us at 97.1 FM and online at revupslu.com. Call the studio at 572